Hi, my name's Margie Dangerfield. I'm a registered nurse, midwife, and independent Zinzino partner, and I've helped almost 3,000 people using Zinzino's test-based nutrition. In this video, I'm bringing you an industry leader and an expert in their field who are integrating Zinzino's personalised test-based nutritional approach into their clinical practice. So, if you're ready to move beyond guesswork and elevate your health and your patient outcomes with precision-driven strategies, you're in the right place. Well, welcome everyone, and thank you for joining us on tonight's Wellness Wednesday webinar. I am absolutely delighted to have a beautiful woman with us tonight. Her name is Kyra. Welcome, Kyra. Thank you for joining us.
Thank you for having me.
Kyra Roberton is a clinical nutritionist and integrative naturopath with a specialised training in oncology support. She combines a deep understanding of clinical nutrition with a broad range of naturopathic therapies, including botanical medicine, nutritional supplementation, and personalised dietary plans to complement conventional cancer treatments and improve patient outcomes. In collaboration with each of her patients' oncology team, Kyra works to minimise the risk of common treatment-related complications and managing side effects. And to further support the mind-body connection, Kyra utilizes psychoneuroimmunology to explore the intricate relationships between mental health, the nervous system, and immune function. So by addressing these interconnections, Kyra is able to facilitate a more holistic healing process that aims to optimize both emotional resilience and physical recovery. So thank you, Kyra. I am so excited to have this discussion with you. And I know that if you're listening to this webinar, you're probably here because you have an interest in the discussion, or you may know someone who has been touched by cancer. So thanks, Kyra. I'm absolutely thrilled to have you here.
It's a pleasure. Thank you, Margie.
What I'd like to do just to kick things off is just so people could get to know you a little bit more, just let us know where you are and the work that you're doing and why you're so passionate about this area.
Okay, so I work at the Health Lodge in Byron Bay. It's an integrated medical centre. It's the only accredited integrated medical centre in our country. My training has been international, so maybe you've heard of Hope for Cancer. There's a doctor from Hope for Cancer, Dr. Javier Curiel. We work together in collaboration with our patients for all things P&I related. I do the functional medicine and he supports with the emotional therapy.
Amazing.
And what really brought me to wanting to specialize in oncology, it's challenging, it's meaningful. And I feel that we're at a good point in time where it can truly be, it can evolve. And we're seeing this on such an international level. I've got patients that go overseas for targeted therapy or stem cell therapy, and their oncologist, once they've finished their chemotherapy, their oncologist is putting them on probiotics. Lactobacillus, acidophilus, not in the billions, but in the trillions. So we're starting to see a shift, and I'm really excited to be part of that.
Fantastic. Now, Kyra and I met down in Byron Bay when I was introducing the Zinzino's test-based nutrition into the Health Lodge. And when I showed you the Zinzino balance oil and balance concept, you got very, very excited.
I did. Yes,
Yeah,
I did.
because Kyra having that deep understanding that inflammation is at the root cause of so many chronic disease processes, or explain to us about why understanding this aspect of inflammation is so critical. And what is it about inflammation that's driving these disease processes?
Well, any practitioner that's working in integrative oncology, we have a natural tumor suppressor gene, P53. We call it the guardian genome. And we know that chronic inflammation, it really affects this gene that we have. It can switch it off. It causes so much havoc, and it's working against our body's own inbuilt design where it can suppress tumor cells. So chronic inflammation, we know, has such a targeted direct effect on the P53. And so what we're aiming to do is to preserve that gene at all costs.
Mm. And one of the things that you loved about Zinzino as well is that we're actually testing for chronic inflammation.
We're testing for it, yes.
Yeah, absolutely. So Zinzino have a balance test that looks at this biomarker of essential fatty acids. And so we're looking at, are you essentially at risk? I just want to share like a bit of a story because when I first got introduced to Zinzino, one of my very good friends had a very strong family history of cancer.
Hmm.
Cancer, as we know, is ridiculously on the rise. There is so much prevalence of cancer, and the average age onset of cancer is starting to appear at a younger and younger age, which is
It
quite
is.
frightening in the community.
Yeah.
And so when I tested her and we did the Zinzino balance test, knowing that the ratio of omega-6 to 3 should be below
Hmm.
3 to 1, I tested her and her ratio came back at 32 to 1. Now,
Mm.
she had a very strong family history of breast cancer. In fact,
Hmm.
her father had died of breast cancer, and she had always been to her GP. She had always been on the lookout, I guess, for, is cancer going to appear? And she was living her life in fear, essentially.
Hmm.
Now, she went through a bilateral therapeutic mastectomy to try and prevent her risk. And once she realized that she had this very high inflammatory marker, what we did for her was say, hey, why don't you take the balance oil? We can show you how to successfully drive that biomarker down. Now, she
Hmm.
took the balance oil for 120 days and it came down to 3.8 to 1. But what
Hmm.
was most remarkable, Kyra, was that her tumor markers that had been elevated for
Hmm.
5 years, giving her all this fear, had normalized.
Hmm.
And what was extraordinary was when she took that information to her doctor and said, my tumor markers are normal, he was like, oh my God, what have you done?
Yeah, I mean, there's so much in that. The nuclear factor, kappa B, that whole signaling pathway, it's it's almost anti-apoptosis. Like yeah, it works, it completely works against what the body's natural tumor suppression gene is trying to do. So by reducing inflammation, then we're reducing the activation of the NF-κB.
And those numbers and terms, like for the average person, they may not understand that, but by by driving inflammation down,
Hmm.
can protect or minimize your risk. Now, we can't say
Hmm.
that we can cure anything, and that's not what we're doing, but it makes sense, doesn't it, that when you give
Well,
your body the
it-
nutrients it needs, it wants to
completely.
heal and repair. Mm.
We see an overexpression of the COX or COX-2 enzyme with patients who have breast, colon, prostate cancer in particular. And what this means is that there's the arachidonic acid that's producing these pro-inflammatory prostaglandins. And when we see this, it means that there's a higher amount of inflammation in the body. And we see with patients with these kind of cancer types that I've just explained, we see this overexpressed, the COX-2.
Mm. So talk to me about why you love the balance oil. What is it about the balance oil that really appeals to you?
I've been on a big mission to have patients reduce seed oils for a really long time. and to reduce inflammation. And so I've been using extra virgin olive oil as for many patients for the polyphenol content. Also because it repairs genes, and I'm always looking at DNA, genes, epigenetics, etc. So when I found an EPA DHA with the extra virgin olive oil, it was just, for me, a game changer.
Mm.
And to be able to test as well, it's so important. A lot of my work is testing. We do microbiome, we do Dutch, we do endomap, we do tox detect, we do glyphosate, we do oats. I'm always testing with my patients. And so to be able to use the balance test as well is really important.
Mm. And not only to test, but also to retest.
Exactly.
That's what
Yes.
we love. And the fact that the balance oil is
Mm-hmm.
the only omega-3 on the market that can actually prove product
Mm-hmm.
effectiveness by showing a measurable change at the cell.
Mm-hmm.
It is a game changer, isn't it?
Absolutely. One of my patients, she was moving through breast cancer, radiotherapy, and she said to me that she felt that she was getting this like nipple sensitivity, and when she started on the Zinzino, after a month, that was reduced for her. So that was, that was just a wonderful feedback. Another patient, we call it a chemo brain, but it's when there's
Oh, yeah.
so much
I've heard of
neural
it.
inflammation,
Yeah.
yeah, and so much inflammation within the brain, and the Zinzino has certainly helped to mitigate a lot of that inflammation as well.
Which is the neuroinflammation, because it doesn't matter what cell, that balance of those
Hmm.
essential fatty acids, it's affecting 37 trillion cells, isn't it? Yeah.
Hmm. Hmm.
And we hear
And
that
at
over and
the
over
and
again.
at the microbiome level, like we know that it's helping with our lactobacillus and our bifidobacteria. We know that this is therefore, helping to the omega-3 anti-inflammatory prostaglandins are then able to do what they're designed to do, take up that enzyme, so then the arachidonic acid can't do so. So therefore, it's anti-inflammatory, and it's working with the microbes to do so.
Mm. And the gut health, that is exactly right. So that's like the second pillar of Zinzino's health protocol is to restore that healthy microbiome. So
Hmm.
yeah, tell me a little bit about what your advice is to your patients, or what you're doing with your patients, and how
Mm.
important it is to restore this healthy bacteria in the gut.
Oh, the microbes are just so important. I do not understand why the microbiome has not been tested for every single patient before they start their conventional treatment plan.
Mm.
And I say that whilst listening to incredible professors and doctors that are studying, that are working with microbes, and they study microbes, like that's their career. And they're able, like new research just came out 2 weeks ago at the Integrative Oncology Conference. Patients that are non-responsive to their given immunotherapy drug, once they had an FT, a fecal transplant, became responsive. We know that patients that have had so many antibiotics before their chemotherapy, they're less responsive to that chemotherapy drug. So that this whole terrain is so important, and it's an adjunct, so it's supporting that conventional treatment plan should that patient choose that path.
Mm. And look, I think people are looking for, you know, natural therapies as well. Yes, we're not saying you shouldn't have conventional treatment, because obviously, that's important, but people are looking for ways to support their health on a
There are
safe,
so many, so
effective
many.
level, aren't they? Mm,
Yes, so many safe adjunct therapies available, and I really do consider the EPA DHA olive oil to be safe alongside microbes as well, where it's indicated.
mm, absolutely.
There's research that shows that the, EPA DHA, it's synergistic in response to cancer biology directly. We also know that microbes are synergistic directly, and we know that because certain microbes work on certain cell lines. We have microbes that support apoptosis, that reduce angiogenesis, which is new blood vessel formation. We've got microbes that decrease cellular proliferation. Like this is all that increase natural killer cells. Like it's starting at that microbial level. And yeah, I'm very passionate about microbes and supporting that terrain. Prebiotics are safe, so most oncologists won't want to use probiotics, more so because that, and rightfully so, potentially with chemotherapy, you're losing a lot of the beneficial bacteria that you're supplementing with. However, what if we're fertilizing with prebiotics before that patient undergoes chemotherapy?
That's a good point. And in fact, what we're hearing from our patients that are using the Zinzino protocol, they're actually experiencing less side effects
Mm-hmm.
when they're going through their chemotherapy
Mm-hmm.
treatment, and that is amazing. So they have less gastrointestinal upset, less weight loss. They're the things that
Mm-hmm.
I'm hearing from
Mm-hmm.
patients who have a achieved their omega-6 3 balance and also
Mm-hmm.
taking our prebiotic fibers. And that's got to be good news for people who are having
Yeah,
chemotherapy.
absolutely.
And it's easy to take. Like it's such a simple um ad add on to your daily regime because it is
Mm-hmm.
very, very simple, isn't it? Uh,
Mm-hmm.
to get tested because it's designed to be an at-home test or in clinic with
Mm-hmm.
practitioners. And I know down at the Health Lodge, a lot of the integrative doctors and
A lot
health
of the doctors,
are
yeah.
there are starting to use this approach
Mm-hmm.
as a baseline biomarker, essentially, I
Mm-hmm.
guess. Yeah,
Mm-hmm. Yep.
which is wonderful. Um, and
And it tastes good. It really does taste good.
yeah, yeah, it is, isn't it? And that's the thing. A lot of people, steer away from fish oil because, particularly people who are knowledgeable in the space and have a
Mm-hmm.
lot of understanding of science, they have never ever sort of steered towards any one product because
Mm-hmm.
they know that fish oil basically just doesn't work because it's oxidizing in the body, right?
Mm-hmm.
Before it reaches the cell membrane. But with Zinzino, it's different because it's based in the olive polyphenol. It's
Correct.
protecting and chaperoning
Mm-hmm.
the omega molecules safely till they deposit it on the cell membrane. And of course,
It's so interesting.
added, the added,
It's so interesting you say this because I was one of those practitioners. It was exactly as you just said. I wasn't prescribing it because I knew that it was oxidizing. When I saw the olive oil, I was like, yes, finally.
exactly. And I've got a lot of practitioners that are doing the same thing. They're upgrading and now they're
Hmm.
recommending Zinzino balance oil based on the
Hmm.
science. And,
And
mm,
I like that it's a decent dose too, and that it's worked out on body weight. We gel capsules. I mean TGA of course, but it's such a minimal dose. We really can go up quite a high dose with EPA DHA.
yeah. And yeah, I mean, that is again personalized dose by weight, again, is unique
Hmm.
in the space. And of course, we also have a water soluble version,
Hmm.
which allows the oil to disperse into micro droplets. Again,
Hmm.
that's revolutionary in the
Hmm.
omega-3 space. So it is incredible. And not to mention the fact that we have data from
Hmm.
1.4 million fatty acid profiles now. So
That's right.
that is by far the largest database of its kind globally. And that data has been peer reviewed and it's about to be published as well. So I can't wait to share that with the integrative team down at
Wonderful.
Health Lodge. So that's very exciting.
So the only time in which it is contraindicated is if the patient's taking blood thinners or is about to have surgery, which of course their surgeon or their oncologist will tell them.
Yeah,
But as soon as that surgery is finished, we want them back on the Zinzino.
yeah, absolutely. Um, and yeah, obviously we always, recommend that our patients follow along with their medical instructions.
Hmm.
But I love the work that you're doing down at the Health Lodge, and I think you play
Thank you.
such a pivotal role in so many people's lives, and
Mm.
you have such a beautiful, empathetic, and personalized approach to your patient care. And the patients that are down at the Health Lodge are very lucky to have such incredible um, practitioners. And yeah, so
Mm.
I would
Oh, thank you
encourage
so
anyone,
much.
yeah, who's interested in learning more from you, Kyra, or understanding what the Health Lodge has to offer. Um,
Hmm.
is that something that you'd like to share with people listening and perhaps put your link into?
Yes, sure, I can do that.
Hmm, okay, that's fantastic.
Especially if there's anyone here, or you may know somebody who could benefit from this. I truly feel as time goes on that the emotional aspect is just so important when someone's on that oncology journey.
Hmm, it is. And people feel lost as well, don't they?
Yeah,
Lost and they
completely.
feel alone.
Yeah.
And
And it's really interesting. There's a new group in the UK where patients can start to educate patients that are in remission, can start to educate patients that have a diagnosis. And it's all led as part of an integrative model of doctors and naturopaths. But there's something so uplifting with somebody sharing their story as well and the success of that story.
yeah, that's beautiful. That is
Hmm.
beautiful. I know you're offering as part of the service now down at the Health Lodge that you're collaborating with
Hmm.
the doctor you mentioned from
Hmm.
cancer. Do you want to tell us a little bit more about that?
Oh, these sessions, I just, whew, they're they're deep. Um, Dr. Javier Curiel is an absolute expert. He's in a league of his own. He works in the space. He's a functional medicine doctor, board certified MD in Mexico. But his area of interest is in emotional biology. So he likes to really explore the biological adaptations that have taken place with cancer patients and why that's so important. If you go back to biology and you look at the cells, like we know that nuclear factor kappa B, like we know that with high levels of stress, that like that that transcription, that signaling is turned on. So if we're not addressing stress, like what are we doing? Like it's such an important aspect of any chronic health concern or condition.
Mm,
And
yeah,
so I really respect his courage. And it's not just courage. Sometimes I feel like if you keep observing and you're in this functional medicine space and you have the opportunity within an integrative model or a hospital where he works, that stress is considered really, it's vital to understand stress and trauma, etc. And he keeps seeing via pathology and via testing that his patients are getting incredible results whilst they're on this emotional journey with him. Like he's getting that feedback of how important it is. And Dr. Tony, the director of Hope for Cancer, like the 7 pillars, he often expresses that all of them are really important, but we are nothing without the emotional therapy. And I really, with time, I'm really in support of that as well.
that is fantastic. And you truly have an incredible program down at the Health Lodge, and it is a wonderful program. So it is a real privilege to have you on this
Thank you.
discussion tonight. And if anyone does want to know more about the wonderful work that's being done, please, we will share Kyra's contact details with you. And if you do want to know more about Zinzino's test-based nutritional approach at driving chronic inflammation down,
Mhm.
please get back to the person that invited you. So thank you so much, Kyra. I truly appreciate your time.
It's been an honor. Thank you for having me.